I'm a fourth year health sciences student, and I'm also doing a certificate in disability and physical activity for persons who identify with a disability. As a second generation Canadian with both my parents born outside of Canada, I was exposed to very different cultural lessons, morals, and principles at home and in my educational setting. I did find myself struggling with my mental health at a young age. Experiencing bullying when you're a kid is difficult, especially when you feel like you can't understand why it's happening to you. That youth are a central piece of the large puzzle that is in fact progressing the field. As a youth with lived experience and experience in mental health support services, I do my best to understand factors that may be of great stress to one's mental health and try to work alongside my youth peers to design methods to alleviate stressors before they can become one. Now, we as youth decided to investigate the impact that the transition to online counseling from in-person counseling has had on youth clients. And this youth-led initiative uses a much different lens during data collection and survey creation than if curated by a current mental health researcher. I wish people knew that living and identifying with a mental illness takes on a different form for each person. I think it's simply just important that people understand that their generalized anxiety, for example, will impact them entirely different than their peer who may also be diagnosed with generalized anxiety. In terms of change, there is one key change I hope to see in regard to mental illness and mental health. From conversations I've had with youth across diverse cultures originating from different lands, there appears to be a common misperception. The misperception being that you need to have a mental illness diagnosis in order to think that you need to start caring of your mental health. And this is really not the case. Taking care of your mental health is not any different than taking care of your physical health. I believe that youth are vital to the discussion of mental health advocacy. Youth bring a different perspective to the table, and the value of lived expertise should not and cannot go undervalued. Since I began this work in mental health, I have noticed a positive improvement of those associated with the initiatives I'm involved in. It is the feeling of connectedness that I feel most contributes to feeling better from a community standpoint. I believe that by assessing and understanding the stressors within your community, adequate organizations run by youth are bound to make a positive difference in the mental health field. In the next 5 years, I hope to see an improved ability of Canadians able to access a specialist, whether it be a neurologist, psychiatrist, therapist, counselor, or any type of mental health support within a reasonable amount of time. To be a champion of mental health, it honestly came as a surprise for me. I was shocked to even be nominated in the first place. Before this, I have never even thought of the concept of being recognized in such a way. It does feel great to be considered a champion of mental health. This recognition has kind of acted as a reminder for me that the work that I am doing is positive and is truly having an impact on those involved.